Hello, everyone. My name is Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, British Columbia. Today, we're going to talk about 5 1-minute exercises for back pain relief. I've been practicing for over 25 years, seeing a number of patients with back conditions, and we often give our patients exercises to do after they start care and start feeling better. So we'll start care, the patient will start to feel relief, and then to encourage them to help themselves, we'll give them exercises to do, including some of the ones I'm going to talk to you about today. So again, my name is Dr. Cary Yurkiw. I've practiced for over 25 years. I've seen thousands of patients with back pain, and I'm located in Kelowna, British Columbia, Canada. Just a disclaimer, it's important to consult with your health professional, go see a chiropractor to get your specific condition diagnosed properly. And once you have the proper diagnosis, then the chiropractor can help you with treatment and the right advice on when to start and stop exercises. I think it's important to know the anatomy of the spine before you start doing any type of exercises. So there's 24 vertebrae in the spine. There's discs in between the bones that act like shock absorbers. And there's nerves that are running through the spine and the spinal cord. The nerves are coming from the brain down the spinal cord, and then branches are coming out of each spinal level, going to the tips of your fingers, and then going to the tips of your toes. There's also nerves going to the organs in the body and the muscles and the tissues. So top priority is to maintain the nerve flow. And if the bones are out of alignment, if there's poor posture, the body will do everything possible to maintain this nerve pathway, including limiting the range of motion and tightening muscles to the point of spasm to maintain the channel where the nerve comes out of the spine. For back pain, we see a number of different causes of back pain. Some of them are sprains and strains that just happened, so someone lifts improperly or reaches for something. We see back pain from poor posture. We see back pain from injuries. And some of these injuries are repetitive strain type of injuries where you're doing a certain activity for your job. And we see back pain as a result of degeneration, wear and tear, and arthritic conditions like osteoarthritis, rheumatoid arthritis, psoriatic arthritis. So there's a number of different arthritic conditions we see in the clinic. Today, we want to talk about 5 1-minute exercises that patients can do to help themselves with their back pain. And the first one that I want to go over is called the Child's Pose. This is very easy to do. Basically, you can be on all fours and then extend your arms and your body so it's flat or parallel to the floor with your arms above your head. So this allows your spine to get some traction. You can relax your body, kind of sink into this position, and then it opens up the spaces between the bones. It feels really good, and you can basically relax into this position. It works the lowest part of the spine very well, where most of the back pain occurs, right at the last vertebrae, the last 2 vertebrae of the spine. And you can do modified versions of this. You can do versions where you have a support or a wedge to support the lower part of your body. So you can use a block or something like that to help yourself if you're uncomfortable, or maybe you have knee pain and you need to be more in a squatting type of position like this versus having your knees too far together. The next exercise I want to go over is called the cat and the dog. And we give this exercise to a lot of patients as they start to get relief from our care, and we want to give them some homework. So we'll give them the cat and the dog poses to do at home, and we instruct patients to alternate between the cat and the dog. So do an alternating movement, go very slowly, and breathe in between, breathing in with the dog and breathing out with the cat. And you can do this for up to 1 minute. I would start with 1 or 2 repetitions and then work yourself up to 6 to 10 repetitions, which really works and stretches the back part of the spine and then the front part of the spine with this position. The next exercise I want to go over is called strengthening the core. And for that, we recommend planks. So the plank is when you're on your elbows, your body's parallel to the floor, and often people do this on their tippy toes. So for the elbow plank, you want to start with a few seconds and see how that feels and give your body a day or two to adapt to that, and then work yourself up to longer time frames and more repetitions. You can do a different version of this called the full plank, where your arms are extended and your body's still in a neutral position like this, but it's a different angle. It still works the body very well. So if you can't do the elbow plank, you could go into a full plank position like this. The side plank is good because it works different muscle groups. It works the groups alongside the spine on the left and the right. So this works the paraspinal muscles, and it allows you to build up strength all around the spine if you do these types of exercises. As the chiropractor works to realign your spine and correct your condition, doing stretches and then strengthening will help to maintain the proper posture and position of the spine. For back extensions, the camel pose is great. And if you can do this where you're on your knees and arching your back, this is great. I would hold this for about 3 to 5 seconds and then go back to a neutral or upright position. You can do several repetitions of this in 1 minute. And if you're getting lightheaded or you're getting any knee pain, sharp pain in your back, talk to your chiropractor about modifying these postures so that you're more comfortable. We definitely want to make sure you're comfortable with your knees, and there's modifications that can be made for that. Also, you may only be able to do some of the back extension depending on your condition, and as the treatment progresses, you may be able to do more and more. For strengthening the muscles on the back part of the spine, I like these extension exercises. So you lie flat on the floor, then you raise your arms up, you raise your legs up, and basically just your torso, your stomach is on the floor. I would hold this for 2 to 3 seconds to start, see how your body responds, then go up to 3 to 5 seconds. And then you may want to go longer and do more repetitions, all the way up to 1 minute. I would increase the time frame each day, also increase the repetitions to use up that full minute. The bonus that I have for you today is sit-ups. And sit-ups are great because if you're on a ball like this and your body's parallel to the floor, have your feet on the floor, your knees at approximately a 90-degree angle, and then just crunch your abdominal muscles and raise the shoulder blades off the ball. Try not to sit up too much, but rather just focus on getting the shoulder blades off the ball, crunching the abdominal muscles. That's going to help the abs get stronger. I would start with 1 or 2 repetitions, then work your way up to 5 to 10 repetitions, and then you want to use the full minute up. And the key here is being parallel to the floor on the ball, and then doing that crunch so that the shoulder blades come off the ball. This will really strengthen the muscles in the front part of the spine, which is going to help support and stabilize the spine as your posture and alignment improve with your chiropractic care. I did write a book on back pain. If you're interested in learning more about this, go to Amazon.com or your local Amazon in your country, and you'll be able to find this book. You just have to type in my name and back pain, and then you'll be able to buy the ebook, the paperback, or get the audiobook version of this. And the chapters in the book, there's a number of chapters, but we do talk about what causes back pain, how chiropractic works to relieve it, how you can help yourself with back pain, and some lifestyle changes you can make to support the healing process. If you have back pain, you can call our office in the Kelowna area. We're at 250-486-0062. You can sign up for future webinars. I would recommend going to Eventbrite and go to eventbrite.ca, type in my name, Dr. Cary Yurkiw, and you'll see the upcoming webinars. And some of them are free and some are paid workshops or webinars. And they're on a variety of different topics like back pain, neck pain, whiplash, joint pain. So we talk about the conditions we see in the clinic as well as the recommendations we make to patients so people can help themselves. On social media, we're on Instagram, Facebook, and Twitter at Dr. Cary Yurkiw. We're also on YouTube, the same handle. We have a podcast on Apple and on Android called Super Healthy. And so I would subscribe to that podcast, and you're going to get webinars like this and tips throughout the week and the month on a variety of different topics. So it's a really great podcast, as well as the YouTube channel. Subscribe to the YouTube channel so you can get updated recordings of webinars like this. Also, our website, www.caryyurkiw.com, you can easily go to that and see more about our clinic and more about what I do. And I want to thank you for joining me today for this webinar. I hope you learned something. Again, I encourage you to go see a chiropractor in your area, get a proper diagnosis for your condition, and then that chiropractor will guide you as far as which exercises to do and when to start them to stretch your spine and to build up strength or support for your spine. I hope to see you at future webinars. Please go ahead and sign up on Eventbrite. And if you're in the Kelowna area looking for a chiropractor, please contact us. We are taking new patients now.